Hi, how are you doing? Right, ICB board, various things that were discussed this week. One of the things that came up as a discussion item was GP well-being, and concerns are being expressed about a number of suicides over a short period of time in that particular profession. And I think we're well aware, as if you'd looked at a recent Times article, it says the difficulty of seeing a GP was the biggest source of frustration in a recent survey that said just 1 in 4 says the NHS is working. That's its lowest approval rating ever, and it's not surprising. So at the discussion with regards to GP well-being, it was regret was expressed around the board table. A number of the groups, hospitals and otherwise, said that they were in a position to provide help and support, etc., etc. And at the end of the meeting, I posed a question to the board, which really was as a result of a King's Fund document, and perhaps Bernard will put this up, but this is basically what it says: making care closer to home a reality, refocusing the system to primary and community care. And this was released by the King's Fund on the 13th of February. And basically what they are saying is that there is far more contact with all of us with our GP and primary care services than any other part of the service. I think it's about 60% of face-to-face contacts are through the GPs. And fundamentally, over the last 30 years or more, the funding and support has continually moved. The money has moved to the acute hospitals rather than community, and community is now receiving the least amount of investment. And sadly, it's been going that way for a long time. And here on the Felixstowe Peninsula, we're well aware that we lost one of our 4 surgeries. We've got a massive expansion of demand with a huge amount of building, and a reluctance, it would appear, by the relative level of the NHS to actually support what we need to be doing to improve not only the surgeries themselves, but to actually turn them into genuine health centres and have a lot more support for the community, both in physical health, mental health, well-being in general. And the evidence within this report from the King's Fund states basically that if you invest in the local community and you actually stop conditions deteriorating to the point that you've got to go to an acute hospital, you actually improve productivity, well-being, the whole bit. Anyway, have a look at the question that I put to the board itself, and it would appear the board was in broad agreement with what I was proposing to them. But have a look and a listen. What I wanted to raise with you is a question from Roy Gray with regards to Felixstowe Community Hospital. But the one that I'm particularly concerned about is, I believe I shared with you some time ago the King's Fund report on driving better health outcomes through integrated care systems, and the roles of district councils in that. And that was over a year ago, but some of you may be aware of a very recent report by the King's Fund saying making care closer to home a reality, refocusing the system to primary and community care. And this was actually released on February the 24th. And it is a very, I think, important document with regards to advising integrated care boards on how they themselves could perhaps drive expenditure in the future to fund a greater proportion to go into community care. Looking at the charts they gave, 60%, I think, of face-to-face appointments are with GP of all NH works. I think if we look at the funding, it appears that primary care gets about 15 billion, and I think acute care gets 80. A considerable difference. And what this report says is the only way you're going to assist community care is if you were to do something drastic like closing a couple of acute hospitals. But they point out that we as a community, with comparable economies and nations, actually have much less hospital provision, give a greater resource into community, because the actual proportion has been reducing and reducing and reducing. And I think acute hospitals can always make a very emotional case for better equipment, and that overrides allocation of funding to community. So I would hope possibly you could make this a particular subject for a forthcoming meeting, in that it is key to trying to improve community care, which would then reduce the demand on acute care. You'd actually have a far better outcome for health and well-being across our home community. And as the dental team pointed out, if one part of the system fails, it impacts on diabetes, a whole list of things were given to you this morning. And we're only as strong as the weakest part of the system, and it would appear currently the weakest part is community health.
Mike, I think that's really helpful. You are possibly preaching to the converted there as well,
Yeah.
in so many respects. Maddie, could I ask you to pick up not now, but the Felixstowe point specifically that Mike raises, and deal with that as a written answer? And Susanna, would it be fair to say that a number of the points that Mike's raising around the King's Fund report and so on will be dealt with, will be a considerable content of the Future Shift discussion, starting on that April the 12th event to which you referred in your presentation. Yeah, so thank you for that.
Could I